Hi guys, this is Surbhi from the Mom Store, and we are back this week with Expert Talk with the Mom Store. This week we will be talking on something very important, which is childbirth. We all know that childbirth is one of the most important milestones in a mother's life. However, it is also the most feared. What makes childbirth so fearful? The fact that we don't know enough about our bodies, what they are capable of doing. Let me start with some facts here. The facts are that 20% of all births in India today are cesarean births. In addition to that, 71% of natural vaginal births are assisted with an epidural, and 90% of all births need to go an episiotomy. We have here with us today Priyanka Idicula from Birth Village, India, who will be joining us shortly and will be talking about natural birthing. So let's have Priyanka join us online. Right, we are just waiting for Priyanka to get online. Yes, there she is. Hi Priyanka.
Hi, can you hear me,
It's
Survi?
yes, I
Okay,
can hear
great,
you.
great.
Yeah, it's lovely to have you here with us today.
Yeah, thank
And
you.
I was just giving an introduction to our viewers.
Yeah,
We were talking about childbirth and how 20% of births in India today are cesarean. And
right,
out of the vaginal births, 71% are assisted with epidural. Out
right.
of those, all of the 90% births have to carry out an episiotomy. So we are
Mm-hmm.
here today with Priyanka, who is the founder and director of Birth Village India, one of India's very few natural birthing centers. And she's here with us to talk about a variety of topics within natural birthing. So welcome, Priyanka. Very good to have you here.
Thank you so much for having me.
Okay. Okay, so Priyanka, let's just dig in and get started.
Sure,
We want to know what is natural birthing and how is it different from vaginal birthing?
right. So, if we were to simply define natural birthing, it's about birthing where a woman is in control without medical interventions, where she has complete autonomy on how or even the position that she should birth in. I'm just putting it as simple as possible. This is how I would define natural birth as. Now, the problem today in our country is that a birth, like you mentioned, is most often assisted with a lot of medical interventions for the last 50, 60 years. So people think that a baby born vaginally is a normal birth. This is what is in everyone's definition in their mind. But actually, a natural birth is one category, a vaginal birth with interventions is another category, and a cesarean surgery is another category. Or, in short, I think the women today, again, for the last 60, 70 odd years, kind of, we have forgotten our path to what a really natural birth looks like.
Yeah,
Probably it's what our grandparents had.
yeah.
Yeah.
That's true, and that's something that we want this to share all of this information with our viewers today.
Yeah.
So, how can an expecting mom prepare herself for a natural birth? How can she
Right.
birth plan, and what all does she need to be aware of when she goes on the path to conceiving and then finally childbirth?
Right. So I think one of the first things an expectant mom should do is she needs to find her own path as to what her philosophy of birth is. What is
Hmm.
it that she wants to do? What is her instinct telling her? How she wants to have this baby rather than listen to the millions of voices around her. This is the first thing I feel. The second thing is we have to accept that birth is very medicalized today. We are accepting this. I am one of the first people to accept that, and I've been seeing it for more than 14, 15 years in my own practice. I think what's very important for a couple is to join for good evidence-based, I repeat, evidence-based independent childbirth education classes. You can decide on whatever you want to join, whether it's Lamaze or whether it's hypnobirthing. But the main thing is it's independent, meaning existing outside of a facility where it is driven by evidence, where the class matches with whatever philosophy you have. And it's the best outcome is when the woman and her partner, whoever it may be, whoever she decides, is doing the class together. We have a lot of women who say, my husband doesn't have time, he's away at a conference, he's got this, he's got that, or mommy told me not to attend, mommy told him, that has to change. So the moment she makes that decision together, then we can see a great difference when you're aware, you're informed, then you know what you want.
Yeah.
The third channel comes in negotiation with your primary care provider. That's the third thing. Because unless you're informed or aware, you really don't know what you're looking for.
Right.
Yeah.
Yeah.
And
I
also,
think
go ahead.
I was saying that, as women, even as couples, people need to open up their minds and understand that there is an option available outside of what they are being shown. And I think when the first step is awareness, only when somebody is aware will they be able to act on it.
That's correct. I completely echo with you on that because they cannot make any decisions unless they are aware. I also feel two other things which are very important in today's scenario is healthy eating is one. Because again, we are in a fast culture, so we tend to substitute with a lot of things, which I think going back to our basics is very important. And very, very important is exercise. We really can't expect,
Preconception or exercise throughout the pregnancy? What is it that you?
I think throughout. I'm definitely recommending preconception and during the entire pregnancy till the very end, till you have your baby. That's it. There are a lot of misconceptions in our country which say first 3 months, no, nothing, last 3 months, nothing. That's all like rubbish. We really need to have a woman who's fit, who is doing her exercises is the one who's the likelihood to have a healthy outcome is definitely higher for her. There's no doubt about it. We are always forgetting we had grandmothers who worked on farms, huge families, no electricity, very less maintenance, and they had very easy births with the help of nothing, So today we don't have farms. So the only option is we have to exercise. There is no other go for us.
Right.
Yeah.
And in your opinion, women who are experiencing birth or pregnancy-related ailments such as gestational diabetes or preeclampsia, or even high BP, do you think that they can go for natural birthing, or is that a factor of their lifestyle, or is it something that can happen in any pregnancy?
See, we need to really identify why do we land up with gestational diabetes. Now, these are all different conditions, right?
Yeah.
Gestational diabetes is one which I feel is highly lifestyle oriented. I feel by tracking it very, very early on with healthy eating and exercise, it is possible that we could somehow, as much as possible, delay its onset, one. Two, maybe even completely avoid the onset. Three, it can be managed in a much better fashion, but however, the awareness has to start early on. This is the first problem. Now let's imagine somebody is diagnosed with gestational diabetes. It is still possible to have a vaginal birth. There might be interventions. It's possible because now this person is no longer under the healthy category. She is having an X condition. The same goes for hypertension. So, and often you notice women get to know about these conditions very, very late.
Yeah.
It's too late in the game. It's too late for them to realize, oh my God, I've reached here. I have a woman, for example, she's 30 weeks and she's developed hypertension. When you look at it, she says, yeah, I had a very unhealthy lifestyle. I was really not doing anything much, which means we could have corrected much, much earlier on. So that is something that's definitely an issue. I'm not saying that they can't have a vaginal birth. I will not say that, but the interventions might be present for those cases.
Okay, and by interventions, you mean like medical interventions or in terms of natural birthing, what are the interventions that you
Well,
need for?
we can expect a woman who's having hypertension or diabetes to be induced by 38, 39 weeks. It's
Okay.
possible. It's also possible a woman who has pre-existing issues, the baby is most likely to also have pre-existing issues. So, which means the care provider is not likely to wait till something develops. That's a very good probability for somebody who has these conditions.
Okay.
So the point what women can do is to make sure they don't get there in the first place.
Okay. And you spoke about induction, and I
Yeah.
understand that induction is necessary when there is a medical issue. However, in
Mm-hmm.
a normal pregnancy, if
Yeah.
a woman doesn't naturally go into labor,
Mm-hmm.
how long can she wait? And why does induction become necessary in some cases?
Right. I think it's totally, we need to understand that the evidence says for a healthy mother, it's totally okay to go from 36 weeks to 42 weeks, which means we have a due period, not a due date. We don't have a due date, right? 42 weeks is 2 weeks post your guest date. Because in reality, I always say that we can't expect babies to just drop out one fine day. There's no requirement, right?
Hmm.
It's like if you
Yeah.
have one tree and you have different apples on it, they all fall at different times. So why
Yeah.
do we expect that, oh my, okay, even if you're sitting in a class and you have 10 women who have, say, for example, August 15th is their so-called date, why do we expect that all of those women should have the baby on the same date? It's not necessary.
Hmm.
Some babies just need more time inside, and in my classes I always talk about it. If you talk to your our grandparents, or our parents, for example, they will have one particular birthday in their ration card, another one in their school, and you still don't know which month they are born, because
Hmm.
they never had a month like that. They more or less
Yeah.
had festivals and celebrations. That's precisely what they had. So I think we need to wake up in terms of birth to go a little bit backwards.
Hmm.
I'm grateful for the technology we have. I'm grateful for the interventions that can save a mother's and baby's life. But are we overdoing it is the question.
Right.
Yeah.
Cool. Um, and what happens, during natural birthing, a baby's position also matters, right?
Mm-hmm,
So,
mm-hmm.
whether the baby is posterior, anterior, or in a breech position, or umbilical cord is around the head of the baby, in all of these cases, a lot of times cesarean is recommended.
Yeah.
So, what are your views? In such cases, is vaginal birth or natural birth possible?
I think number one, a cord around the neck is not a reason for a cesarean section. I will say 6 out of 10 babies will have that. That is not a reason. The second thing that you mentioned was position. See, again, positioning depends on how active a woman is. I don't feel a posterior baby is also reason for cesarean, but she may need more time in labor. She
Hmm.
may have a longer, earlier labor. She may need a lot of movements and work with the body to turn that baby. That is very much possible. But it doesn't
Hmm.
mean that these conditions mean that a woman has a cesarean. There's no reason for that. The only technical reasons for a cesarean is if the baby or the mother is not doing well.
Hmm.
There is distress. Again, we know that a lot of these conditions could be mediated by induction, because when a labor is being induced, there is a higher chance of baby going into stress. We know that. So what led to that stress is another question altogether.
Hmm.
So it requires a lot of awareness, a lot of learning and unlearning for us to reach that right space.
And I think in all of these cases, there should be a mental preparation for the unknown. Like birth in itself will be unpredictable. You cannot say that
Absolutely.
that's how it's gonna be like.
Mm-hmm,
So
mm-hmm.
you should be prepared, and I think that's very important. One woman should be prepared then how to handle when things are not going as per her plan or as per how she had envisioned it.
Right. I think that's a really nice question. And I think what's really important is that um, as women, we need to be open to both sides of the coin, A and B. The first thing I always tell women is when you choose your place of birth, whatever it may be, make sure you interview at least 3 or 4 spaces, minimum 3 or 4 spaces. Make sure you are having a dialogue with them on what you exactly want, and don't stop. Don't stop till you reach your place where you feel your philosophy matches the best. That's the first thing. Now, once you reach that space, you develop a trust with that particular care provider for the outcome that you aspire for. Now, should there be a deviation, I still feel there are certain practices. For example, even if there is a cesarean surgery, I still feel there is no reason why breastfeeding should not happen at its optimal best. I don't see why a baby and mother needs to be separated. There are numerous cases where they say the baby was not with the mother. So many times we hear this, and that is heartbreaking for any mother. You know, though there are so many things we can improve around this, and I feel some women, the partners have to step up. A woman may not be in the best position to advocate for herself after a surgery, but if the partner says, no, I want to bring my baby here, nobody can say no to that. I want my baby to breastfeed. I don't want my baby to get formula. If the husband were to say that, I promise you a lot of people would step down. You know?
I think when you're in that vulnerable position and you've just given birth, it just becomes very difficult to be aggressive or assertive. Like,
Very, very.
in my example, I had a perfectly normal pregnancy and I did not go into labor by my due date. So I had completed 40 weeks and then I was advised that I should be induced and I didn't get any pain. Then I was moved into cesarean section, and then I had read about all these things, and I wanted to feed my baby as soon as it was born. And I just remember I was like half passed out and half awake, and I'm like, please let me see my baby, and they just took the baby away.
Yeah.
So, yeah, I understand that, and they were telling me, we are your doctors, we know the best. So. But yeah, I understand how challenging that can be for a mom.
It's too much. It is way too much. And I feel for your story. And that's the story of so many women in this country, right?
Yeah.
What you're saying so boldly out there is what you're speaking up for so many women who go through this, right? And, what I feel sad is that our power is taken from us, right?
Yeah.
It's almost like we are a nothing, right? We carried the baby for 9 months or so, and suddenly everybody else gets to decide what has to be done.
Yeah.
And that's not right. That is just not right. I feel very strongly about women and mothers' rights, and they do have rights. But it's just in that moment you are told to be a what I call a good patient.
Yeah, I know. And there were so many things that I read about, immediately holding your baby like a skin to skin before the umbilical cord is cut off. Immediately feeding the baby so that the supply gets maintained and so on. And none of that happened for the next 3 hours.
Right.
I was just waiting in the I had been moved to a room and I was just waiting. I'm like, where is my baby? I want my baby. So, and I'm just speaking this out because here I am talking to you, but I'm sure many other women have gone through a similar fate.
Right. And I tell people, when you search out your place, one is we interview, directly finding out, but always remember every mother has to know minimum 3 births that happened there and whether those 3 births that happened there are exactly what they want. Because I could be a care provider telling a million things, but actually nothing, reality happens. So you need to look at, like you mentioned, skin to skin care, whether a mother is really looking at whether that actually happens there or not. Because if I'm saying it and it's not happening, it's not going to happen. And I'm, it's just not going to happen. That's it. I keep saying, and also we look at, for example, VBAC, or women who are trying to achieve planning a vaginal birth, planning for a vaginal birth second time. I keep telling you need to go to the ends of, your spectrum, your patience, everything, perseverance, to search all your options out and don't stop till you reach there. It could be the unconventional, whatever it may be, but don't stop till you reach there. You don't have to please ABC, because you know what, like you mentioned very boldly, that it's you who's alone on that day, right? Everybody else, the mother-in-law, the mother, even the partner for that matter, is outside that whole sphere. It's the woman, and she's alone.
Yeah.
She's alone. Nobody looks at that aspect, that she's alone.
And you're like half passed out with the epidural and the anesthesia.
Yeah.
So it's really hard to know whether your head is just spinning or you're actually talking straight.
Straight. I know, I agree. Yeah.
Okay. Why don't you, talk about some of the techniques used in natural birthing, like water birthing, hypnobirthing, how are they effective?
Yeah, so I think some of the things we talk about is when a woman is laboring, number one, she should be in an environment that supports her. One, two, she needs to be in a space where the care providers are able to let her do her thing. It might look a bit wild to others, but she should be free. Freedom of movement is very crucial. Now, when we look at what all can a woman adopt, she's birthing in a position of her choice in the environment of her choice. So, birthing in position of her choice means a woman can be birthing squatting, kneeling, hands and knees, using a birth rope, using a birth stool. She could be using the water, for example. Now, water birthing is a technique that's very popular across the globe for at least 80, 90 years. Its advent in India might be relatively young. We're one of the oldest centers to have water births in the country, which means a lot of experience. Um, Now, women, when they enter into water, they feel a sense of peace, calm. It's almost like when you have your menstrual cramps during periods and you have warm showers, you feel really good. So, when you're having labor contractions and you're in water, you feel really good. I've seen women who are just dilated like 4 or 5, they go to 10 in 1 hour because it's the relaxation that facilitates the descent of the baby onto the cervix. So the moment she's relaxed, she goes super smooth. So that can happen. She could have the baby in water, push the baby in water, and a lot of people ask me about babies breathing. But what we need to realize is that babies technically don't breathe till they reach the surface of air because that's what prompts breathing.
Yeah.
So that's one. Now, when you talk about hypnobirthing is again, it's like meditative tracks, and you have different schools of hypnobirthing. Uh, Again, you should be a person, I feel, who's into yoga, practice, meditation. You should have, it's not something, if you're a very analytical person, it doesn't work for you. If you're a person
Mm-hmm.
who already has a practice of meditation and you truly believe in it, it will work for you.
Mm-hmm.
And all this can be explored. So hypnobirthing works with a little bit of practice on the tapes, guided meditation, relaxation, where she uses in labor, and she kind of zones out. She kind of zones out, goes into her sphere, and birth. I always say this: it can be actually a very beautiful event if
Mm-hmm.
we allow it to be. you know
Yeah.
we always say in our language, a good midwife is one who sits with her hands in her pocket. Yes, we can take it out of our pocket if we need it, but as much as possible, keep it there.
Yeah, that's true. And so, in natural birthing, is episiotomy needed? Because a lot of women are, at least in the medical way of giving birth, need to undergo episiotomy, a few inches of cut they have to endure for the push out.
Yeah.
So, is that needed when you're naturally birthing, or that is also something that a woman is able to control?
So I think first thing, let me talk about. Let's go evidence-wise. The World Health Organization has mentioned episiotomy should not be done for more than 15% of the population in any geographic location. 15%. The saddest part is, however, India practices at 98 to 99, which
Yeah.
means there is a big gap between what is recommended and what's in practice. So that's one side, which means it's not necessary. Now, from the view of a birth center, I mean, personal practice, the only thing I can mention is 10 years of practice. Maybe we have done maybe 6 or 7 episiotomies in 10 years. So actually, it can be used if the baby's in distress or if there's a real need to get the baby out, but otherwise, no. There is no requirement. And I also urge women to think for a minute how our grandmothers birthed without this.
Mm.
We are a product of a generation that came without an episiotomy. You know,
Yeah. True.
we are living proof of it, and our grandmothers are very much alive.
Even like forceps, right? Or
Totally.
is
Yeah.
yeah.
No. See, forceps and vacuum come into the picture more when there's an epidural being used,
Because the
because
push urge is
yes,
not.
yes, that's the reason why it came about. I also feel there is this strict time limit kept. You're 10 centimeters. Now you start pushing, like how you have in the movies, and that's built into our brains, right? It doesn't have to be like that at all.
Mm-hmm.
She will find a space. Somebody could be fully dilated but need a few hours to push the baby out.
Yeah.
But we
I
need
think
to
I'm
give
very
time.
yeah.
Yeah.
I was, around having that freedom of movement at that time of labor. Because I think what happens usually is that you're strapped to a bed, or and your legs are like just wide open, asking you to push. But that freedom of movement and the
Very
ability
crucial.
to control pain is
Yeah.
not given to you.
That's correct. I agree with that.
Okay. So I think we have a lot of questions coming in from the audience as well, and let's start taking that.
Sure.
For one of the questions which had come yesterday from our stories is, can water birth be done at home under experienced supervision, or can it only happen at birthing centers?
See, what's most important for a water birth is that it depends on who's attending it. The primary care provider must have sufficient experience in it, also must have all the necessary protocols in place, including resuscitation, everything, whatever is required. Now, abroad in Western countries, yes, it does happen at home. Whether it's UK, European countries, yes. But India currently is not, I would say, overall equipped with it because our response times are not that fast. Should there be an issue, we don't have a 911 that comes and stands immediately outside. This is the problem as
Right.
far as.
And one of our viewers has asked us that a very common issue that happens during delivery is that baby passes meconium or stool, before coming out, or it gets mixed with the amniotic fluid. So what happens at that time, and how do you deal with such a situation?
So that's a question for the birth center, right? That's a question is for the birth center. Is that right?
Yeah.
Yeah. Okay. So 6 out of 10 babies will pass meconium. Again, so a baby could have passed meconium at 38 weeks, 39 weeks, 40 weeks, 41 weeks, 42 weeks, any point. It could be simply because the baby is mature. It could be because of some stress during labor. It could be that the baby had a slight bit of stress somewhere even much before. So what is taught to us is that even if the baby passes meconium, if the baby's heart rate is good, one can still wait for labor. It's not a problem. But that means we listen constantly to the baby's heartbeat, which we always do. Now, the American Academy of Pediatrics has very clearly mentioned, even if there is meconium, if the baby is born, is alert and active, leave the baby alone. They have mentioned it very clearly. But like I said, there is a lot of difference between protocols, what is in practice and theory. It's a lot. So, yeah.
Okay.
Yeah.
Can a breech position baby be delivered vaginally?
Yes, of course. Why not?
So, I mean, what happens? Like a little more information. Is the position changed, or do you wait it for it to change, or can it actually be delivered?
Breach vaginally, right? That's the
Yeah.
question. Okay. See, what I try to do is, if as a midwife, we are pretty good with hands. So if I feel someone's belly, I kind of know where is what, even if we don't have a scan machine. So if I feel the baby is breached, the first thing we do is we try to work on exercises to help to turn the baby. That's the first point. That's where we are starting from. And some babies will turn, some babies may turn in labor, and some will not turn at all. So when they don't turn, we need to understand that that baby is comfortable in that position, right? For whatever reason, it's comfortable in that position, and babies can be born like that. It means that the baby might be born with its buttocks first, or it could be its legs. But again, we have to understand that in our country 10 years ago, this was happening normally. It's in the last 10, 15 years, these rules have changed. And now again, in the US, they are again going back to a trial for a breech birth. It's going back again.
Yeah.
And also, yeah, go ahead. Yeah.
Since we are on this topic, I also wanted to talk about multiple births.
Of course, yeah.
So, yeah, in case of multiple births, I think hardly any births in India are happening vaginally. Like, as soon as somebody knows that it's going to be twins or triplets or whatever, it's already planned that, a C-section will be done once the 37 weeks are completed. So, what are your views on that? And obviously, there are two kinds of multiple births which are happening. One are naturally conceived, and the others are through IVF or, other interventions.
Yeah. See, I feel There is no medical evidence supporting that. There is no medical evidence supporting that if you're carrying twins that you need to have a cesarean section. It's not supported by medical evidence. We have supported twins having a healthy birth vaginally, naturally. I think what really is important is mothers should maintain high level of nutrition because it's important. For them, it's double the effort, double the work to maintain two babies inside. It's not easy. It involves a lot of follow-up, a lot of body work, number one, but it's very much possible. There's no reason why they cannot. You know, there's no reason. But I do feel that where we fall a little bit is in terms of eating and exercise. And somewhere, like you mentioned, it's drilled into the mind that I will have a cesarean section. So I'm not going to do anything.
Yeah, especially if, it is an assisted conception.
Yeah, assisted conception. And because there's already fear running in their mind. If fear is already running in their mind, they're fed with come out of it because their theory is, how can I just have this baby? That's it. The channel or the birth path is not really important to a lot of people because that is what is drilled into them. That's it.
Right. Okay, there's another question on amniotic fluid. What about low amniotic fluid? So if a scan shows low fluid, what should be done in such cases?
So the range of amniotic fluid is anywhere from 5 to 25. That is the range. When it falls below this, yes, there are question marks that come into play. There may be additional testing, additional monitoring, additional scans that are required. And it depends on each care provider. Some people will go up to 5 as a cutoff. Some people go up to 2 as a cutoff. It all depends on the whole picture. I also feel hydration is very crucial. And I've mentioned it. And I've personally felt if a woman is being hydrated really well, up to 3 liters or so, lots of coconut water, I think there's a good chance her fluid levels will remain higher up because amniotic fluid is 80% baby's urine. That's what it is. Yeah.
Okay. Does overweight matter for vaginal birth?
So what is that? Sorry?
Does being overweight matter for vaginal birth?
Okay. Well, a woman with a higher BMI needs to see that she doesn't gain too much during pregnancy. There's a limit on how much one can gain during pregnancy. That has to be watched very, very carefully. That's one thing I would suggest. The second thing I would suggest is that it's not that they cannot have a vaginal birth. There is nothing like that. In fact, one of the moms that I have attended, she was 110 to begin with, and she just gained like 3 kilos in the entire pregnancy. And she actually birthed before I reached there. So, we can't judge a book by its cover. We just can't, and it's wrong on my part. It's true that, and actually I feel women who have high BMI and overweight should not have a cesarean surgery because it actually leads to more complications with them when they have a cesarean surgery.
The recovery period would be longer.
Every recovery, and they are at a lot more issues during the surgery. Yeah. So I think they should aspire for it and work for it and educate themselves on how do I go about it.
What are some of the recommended exercises for a smooth vaginal birth? I think this can be long, but in short, if you can just...
In short, okay. In short, walk 45 minutes every single day. Get a lot of sunshine. Climb 200 steps a day. Most importantly, join a good exercise program. Join a good exercise program which will keep you on your toes at least 3 or 4 times a week. Or join a good yoga program specifically for pregnant mothers who knows the pregnant body. Join one because these are decisions that are very, very crucial that will matter for you. Yeah.
What is your take on ultrasounds? How many are really necessary if all is well?
I think the important ultrasounds is 10 to 14 weeks, the NT scan, which is looking for Down syndrome, 18 to 22 weeks, which is the anomaly scan. Those are the medically indicated ones. That's it. Again, people have asked me.
I think actually post 37 weeks in hospitals today, there is a scan every single week.
That's
till
not
the time
required.
you
Yeah,
go
no,
into
no, no,
labor.
no. There's no, see, I'm talking purely from an evidence point of view. These are the only two in the entire pregnancy. The other problem we have, I think we must accept, is women's, we don't, we don't feel women's bellies anymore. Like as a midwife, we feel, we measure, we write with our hands. We are, that's what we are doing more. And if we have a doubt, 100% we will refer to the ultrasound, but that should come first.
Hmm.
Also we have to accept in our culture today, we like looking at screens. We like to see images. That's
Hmm.
just where we are all going. They tell me things like, I like to see the image,
Maybe.
the photos, because we are relying on a screen and not on ourselves anymore. Very few women can say, I'm not sure if my baby, they just don't feel confident anymore. Or women are made to feel like puppets when they have so much of strength and capacity. So there's so much of changes that we have undergone, and sadly our community is feeding us more into it.
Right.
Yeah. So I think the important scans, yes. Again, people have asked, if there's a problem in the scan, what do we do? If somebody detected with a Down syndrome or there was an anomaly scan, honestly, there is no treatment that one can do. The only decision is whether the woman wants to go forward or not. And there may be women who say, for religious reasons, I may not terminate this pregnancy. And actually, in that situation, it becomes another big question mark. What was the point of all this? Yeah.
Another question, and I think that's a commonly faced problem, is that your baby is big, and that's why you need a C-section, because your pelvic is narrow,
Torn.
or
Yeah. Yeah. I see a big baby is defined as anything over 4.5 kilos. That's a big baby. Anything less than 4.5 is not. And whether the baby will come through or not is highly, highly dependent on labor.
Hmm.
Two, if the woman is walking and mobile during labor, if she's just lying around, lesser the chance. So walking, movement, position, supportive care provider, everything will matter. If
Hmm.
all these factors come together, still, I've seen, like, some births, even I've been very surprised. I've seen some really short women, like below 5 feet, and they just come and blast a 4 kilo baby just like that. And I'm like, wow, just look at her, I feel so wonderful when I see these women just come and prove everybody wrong just like that.
It's incredible what our bodies are capable of. And I think the human
Totally.
generation, as a species, has survived so long because natural birthing has happened. And I guess it's only in
Yes.
the last 100 years we started believing that, oh my God, it's such a big deal.
Yeah. And I would say, with respect to India, it would be the last 60 years.
Hmm.
When you talk to our grandparents, they don't know what the weight of their children was. Who knows what the weight was? Nobody knew, like, whether they were big or small. Like, no, there's no records of these things. So how do we know what the weight? Now, for example, my parents were born at home. I don't know what their birth weights were. We have no idea of these data. So whether are we fussing over data that is relevant or not relevant?
Right.
Yeah.
Any specific superfoods to eat for vaginal delivery?
No, not superfood so much. No, I think what's really important, I would say, is invest in learning about
Hmm.
birth, because one of the biggest, and I feel, and I'm saying this because we are in a very consumerist society, we spend a lot of money on a lot of things, but what really matters is that you and your partner invest time together in really good childbirth education classes. This is the one decision that will change your birth. The one decision that will change your birth. Everything else, I'm not saying not to get your things, I'm not saying that, but this is the one decision that will matter your entire pregnancy, and not only a pregnancy, even as you as a woman.
Right.
Yeah.
And now that we've spoken so much about childbirth in general, what should happen immediately after birth? And,
Right.
let's just talk a little bit about postpartum from a few minutes after birth to the first 40 days. So let's start with, what should be done immediately after birth, what's extremely necessary. And then we can talk about a little bit of postpartum care before we log off.
Right. So I think one of the things that I really feel that's really important is that when babies are born, we talk about skin to skin care. immediate. That is, babies are born, they should be with their mothers on their chest immediately. We also talk very strongly about wiping, all these procedures to be delayed, because the baby is coming covered in amniotic fluid, it's on the mama's breast, it's smelling its own fluid on its body, it's connecting with the mama's nipple, and they can go and self-attach themselves. Whether we talk about weight, height, all these measurements can be done later, and it's not going to change. The weight is not going anywhere, right? So what's important is the baby and the mom is not separated, and we need to see the mother and the baby together as one unit, not as two separate units, one unit. The baby transitions beautifully on the mother's chest. The mother's chest is the best incubator we can provide. It's really nice and crucial, and what we call about the first golden hour, it's the first hour after birth, where babies feed within the first 45 minutes of life, because that's when babies get colostrum. That production starts from there. The more we delay it, the more it's going to go further ahead. So that's number one. The second thing I talk about is postpartum. Is women need to know that postpartum is about healing. We don't have to be doing a million things. We can rest. We need to step back. We need to sleep when baby is sleeping. Sometimes there's a lot of, I keep saying this, if you take care of your body and your uterus for 6 weeks by staying in, and this is especially for women who have larger families, if they take care of their bodies, then the future will take care of itself. You know, this is something that we need to be mindful about. Now, it's different for different communities across India. But for example, in Kerala, Ayurveda reigns supreme. So we have a huge Ayurvedic diet and kashayams and baths and so many things. And I'm sure up north and west, you have the Malishwari ladies coming in. So if these things done for the mother is extremely helpful, very beneficial, and it will help a lot in the uterus to involute, go down. And I think we have to, one thing I feel strongly maybe against is we have too many visitors. I
Yeah.
think there's way too many visitors coming in the postpartum. The woman is just trying to figure her baby out. You know, she'll figure it out. I always have strong belief a woman knows her baby the best. Not the pediatrician, not the doctor. Now I'm a midwife, not a midwife. I feel the mother knows the baby herself. You know, we have to trust that. She knows. She knows, and she is the ultimate authority over the child. I don't
Yeah.
understand how everybody else can talk for the child other than the mother. So
And I think
she
a woman, sorry to interrupt, just to
no, go ahead.
reiterate there, a woman needs to be very strong at that time to take a stand. Because I know
Yeah,
in India, communities or, families can be difficult. They can be imposing, and especially with the whole idea of care coming from either the in-laws or the parents being there present all the time. I think that preparation also needs to start pre
totally.
delivery,
Absolutely.
saying that that this
Yeah.
is how I'm going to bring up my baby, and I want to be in charge, and I want to take the decisions for my baby.
You
And
said
that
it.
I will probably take your opinion, but it doesn't mean that I'm going to follow it.
Absolutely. You get to decide what you want to do with your baby, because you know what? Grandparents have finished their parenting. You
Yeah.
start, and I keep saying this, you can make mistakes. That's okay. It's okay to make mistakes, but don't make somebody else's mistake. You
Hmm.
know, you do your thing and you figure it out, and you whatever it is, you do it. And it's really wonderful if both the husband and the wife decide together, and the COVID is a very good time for this. 10 days, no visitors. Nobody is
Hmm.
coming here, because if you can stay indoors with your baby for 2 weeks without going out anywhere, you'll figure it out.
Hmm.
No
Right.
visitors, nobody telling you what to do. You just do your own thing. You've got this covered. But the
Yeah.
point is, to people just keep barging in, and some people think like it's rude if we don't go visit. It doesn't mean anything, you
Yeah.
know. And often I find as a care provider, we send moms and babies home. Usually, I mean, they go home pretty fast for us, 15 hours or so, they're back home. I find it very discouraging when we go at the 6th day and the 8th day and we see the baby has a fever, and we know it's come from outside.
Yeah.
So I tell people, please understand this. For the newborn period is up to 6 weeks.
Hmm.
The other thing we don't talk about is postpartum depression. A
Yeah.
lot of women go through that, those feelings of ups and lows and downs. And everyone thinks, a lot of people say, oh, if she's had a cesarean surgery, you're good. Baby is good. Everything is fine. Actually, it's not good.
Hmm.
She's crying inside,
Yeah.
and she's trying to force herself to do things which she may not want to do. Leave her alone. She may not feel like doing things and she doesn't feel like celebrating. And people say healthy baby and healthy mother is that matters. I'm sorry, but that's not what matters. How she feels is very, very crucial.
Yeah.
Maybe she doesn't want to see anybody. Maybe she doesn't want to function. Maybe she doesn't want any of these things.
Yeah.
So I think we have to step back, and I think for a husband or partners, they need to preserve her space. Let her just be. I've heard of women who said, I didn't want to come out of the room into my living room for 2 weeks. I've heard of this. And it's okay. Why force her to look at people when she doesn't want to talk to anybody? So
Right.
I think it's very important. And also I think the last, but again, a topic nobody wants to talk about is if there is signs of suicidal tendencies, and then those are extreme things, extreme cases. But if the care provider has attended good education classes and is aware, he knows what to pick up on. And he knows whom to refer to. Because if we don't refer that mother, we may actually lose that mother. There are cases when women...
Or at least do some level of mental damage for, even if not months, years to come.
Yes.
Because she found it so difficult in that period.
That's right. And a lot of women say, I felt very alone. In one way, you look, Indian culture, we have a lot of people. At the same time, they say they feel alone. It's both. So people just hanging around doesn't mean anything unless there is somebody she can really connect to.
Right.
Really connect to and be for her. And okay, how do you feel like today? Do you feel good? Do you feel, where is your mind space?
True.
Yeah. So those are my thoughts on the postpartum.
Yeah, and I think it's been a great discussion. We are at the top of the hour now. If we don't say goodbye, Instagram will bounce us off. And yeah. And so it's been a great experience. We will probably have some queries still coming in as this video goes on IGTV. And some of those queries we will refer to you as well from your handle Birth Village India. This is to wish women all the best in this beautiful journey and encourage them. This session is purely informational. The idea of this is to not recommend a certain kind of delivery. You are in charge of how you want it to be.
That's the whole point.
It is purely informational. And so thank you, Priyanka. And you're doing an awesome job with Birth Village. And we hope that more and more women get completely in charge of their bodies and the way they want to do their births.
And I should say thank you, Surbhi, for, you're so bold to talk about your experience, and you are the voice of so many women out there. You actually spoke for so many people what they feel, right? And you brought it out. And so many women will be thinking, I was that mother who went through that, and that's the beauty of this live, is to talk about women, what they go through and what they can do into the future.
Yeah.
So really hats off to you.
And help anyone out there to, get in charge of their birth plans and decide how they want to go about it and be fully aware of all of these options available to them. Then we've won a battle.
That's right.
All right. Thank you, Priyanka.
Thank you so much. Thank you.
Have you heard.
Same here. Thank you. Yeah. Bye.